In Buncombe County, access to low-cost or no-cost medical facilities is critical. We found that there are 50 such facilities available, along with 111 low-cost or no-cost behavioral health providers and 47 substance use treatment sites across both incorporated and unincorporated areas. Our assessment also highlighted the importance of emergency medical services, EMS, and community health workers, CHWs, in enhancing healthcare access. Since 2020, approximately $781,000 has been allocated to support the community paramedicine team, which includes services like post-overdose support and homeless outreach. Community health workers collaborate closely with EMS and focus on outreach and health education in specific communities. Continuing with our assessment, Buncombe County has prioritized access to healthcare services through initiatives like the Public Health Mobile Team, which has provided services nearly 240 times at various locations and events. Additionally, the Health Promotions Team plays a crucial role in collecting health data for the Community Health Assessment and SHIP, as well as connecting with healthcare community partners to fulfill state contracts for health focus areas through grants and procurement. In our assessment, there were challenges with data completeness, particularly in the Healthy North Carolina 2023 scorecard. This scorecard is an important tool for identifying progress and building community trust. However, a noticeable amount of data was missing or incomplete among the nearly 30 organizations and approximately Now, the Buncombe County Public Health has also made commendable efforts in health education and literacy. The community engagement market coordinated over 650 events from 2020 to 2023, with an average of 17 to 20 monthly events. Promotes health-related outreach and engagement through various channels, including radio appearances and press releases. The Buncombe County website provides easy access to public health information, event calendars, and contact details for county employees and community partners. Now for our key harm indicators. Within health, it was identified as a lack of available healthcare providers and racial equity training in healthcare. The 2021 CHIP report highlighted challenges such as provider shortages, transportation barriers, and the absence of BiPAP providers. Additionally, staff of community partners are not required to undergo racial equity training, which can further perpetuate disparities. Our second key harm indicator is it revealed a lack of data evaluation and tracking and essential operational metrics within Buncombe County Public Health. This includes metrics such as cost of services, staffing ratios, appointment times, geographical locations of services. Better tracking of outreach efforts is also needed to effectively assess accessibility, efficiency, and overall impact on the community served. Thank you.
Are there any questions about that with regards to health? Yes.
Yes, Jesse Ray. I did not see on page 8 of your Okra Compass under what opportunities provide access to health care, nor throughout this presentation any reference to health insurance. Did you not come across a lack of or anything about health insurance having an impact on access to health care?
Yeah. So to your question, the First, what you're seeing on the screen is provided for you as an example to show you how the Okra Compass operates. The issue regarding insurance is reflected in the low-cost, no-cost medical facilities. There is some data around where you all stand as in terms of where your listing is as a city and county in lack of insurance. I don't have that in front of me. However, you all do have 50 low-cost, no-cost medical facilities, et cetera, as seen in the presentation, and that is in response to those who are uninsured. Now, overall, our findings for health and wellness is very positive on behalf of the county in terms of the services that they provide. The lack of information is in the data. Where are they tracking who's being serviced? They have excellent community partners that they've built relationships with, and a lot of money has gone toward that. But when we start asking those questions about how many people are using those services, do they have racial equity training? Where exactly are they located and how many people are being serviced in those neighborhoods or in those locations, right? That data is not there. So when we start looking at what it means to cease harm, that data becomes very important, right? So part of the process in our recommendation is the need to begin to link the funds with the request for that data.
Yes.
You had a question?
Yes, Ms. Vice Chair.
I see on page 21, under the key harm indicators, it says lack of sliding scales, BIPOC providers, and realistic payment arrangements.
Yeah. And let me clarify something. Part of our information around health, a lot of that is already done through the CHA and the CHIP, right? So some of the information is what we gathered came from out of there. What we did was follow up with that information with the county to see what's the progress in those particular areas. And what the county did was, I'm gonna go back to it, is they identified 3 main areas as their focus, which came out of their committee. There is the CHIP advisory group, which comprises of 40 organizations. And based on the findings from the CHA and the CHIP, they identified that birth outcomes, mental health and substance abuse, and chronic diseases were the 3 top priorities that they've had over the past, I would say about, now 3 to 4 years. And based on those 3 priorities, they have funded organizations to the tune of 28 organizations to the tune of $4 million with over the past 3 fiscal years to address those specific areas of birth outcomes, infant mortality, mental health and substance abuse, and chronic disease, which includes diabetes and heart disease.
So is it correct to assume, because it said lack of data segregated by the things that y'all would like to see as far as race, sex, gender, all of that stuff, lack of data. So is it safe to assume that we don't really know the impacts of those 3 or 4 years of fiscal years of $4 million funding? So we don't really see like the actual impacts of that. Or
now, what the county has is a scorecard, which Ms. Hibbert mentioned. The scorecard is a website that tracks some of these metrics. Personally, I think they've done a good job in developing that particular scorecard so you can track the metrics. However, the information is not there, it's incomplete, right? So we're not able to see the impact. So there are positive efforts, but incomplete, in which in our ability or our desire to assess harm, we cannot completely or holistically do that with that lack of information. Yes.
Tiffany Debelow here. So right in line with what Dewan is saying, still on page 15. So we're looking at over 100 organizations being funded. Do you have recommendations? So we can't track the harm because they have not tracked their outcome metrics. But can we move forward from a recommendation to make sure that the harm doesn't continue because they're not actually tracking their outcome metrics? And I say that to say, because if we're looking at the key harm indicators, which is a staff that lacks racial equity training, they're paying over 100 organizations. How can we ensure moving forward that these organizations are truly going to have some outcome metrics that's going to benefit Black people?
When we were doing the assessment, the question that we asked in going through those access points and those representation points is, do you know when you bring an organization, you fund an organization, do you know if they have received racial equity training? Well, the answer is no, right? So the recommendation is, how do you begin to include that in the process of your application and their reporting? And some of these organizations, please differentiate between the organization. There are 28 community partnerships, but then there are over 40 programs. So you can have a partnership that has more than one program. But between the organization or the program that's being run, it now becomes important to begin to gather those specific data. I think what part of our we made a recommendation on what some of those data points should be, but ultimately it's about in this particular case, the county, that health department looking at what do they want to track that's relevant, especially if we want to talk about cease and harm, in addition to our recommendations.
Thank you, because Buncombe County is working towards being more equitable as far as BIPOC organizations that they fund. But we do want to make sure that they're not continuing to fund white-led organizations. And we're talking about, could be 10, but with over 100 services or different types of services, because instead it's still not positively impacting Black people, even down to the point that they're not even measuring it, which tells us that we're not even that important in 2020 to 2023 to check that measurement or keep up with that measurement.
I would say, in response to that, in my experience going through this process and our team going through this process, I think what has shifted in the conversation is this is an audit, but it also serves as a baseline report. Baseline in that some of the people in positions have never even thought to look at that metric. They've never thought to measure it. And I think the conversation around reparations and cease and harm has now birthed a different vision around how, right, especially coming out of this study, is if we want to assess harm, then this is what it would need to look like. And these are the type of metrics we would need to track. Prior to this being the conversation, we can, contend that, yes, someone should have still been looking at that particular data. But I think it's one thing to not have to report on that data. And then we begin the conversation about harm, and then it raises a question about data that they were not considering before.
Thank you, that's excellent. Thank you.
Yes.
Renata, I would like to ask, and I don't know if you can remember, and the companies the places that you asked, how many, did they explain why that they wasn't offering it?
We're tracking certain data when you say offering?
Yeah, offering, I'm sorry, I'm in left field today. What was the word again?
Outcome metrics?
Not outcome metrics,
Demographic.
demographics, yeah, outcome metric demographics and stuff, and why they wasn't training their staff?
Oh, well, so it's what's happened here is, and this goes for both the county and the city, is that the county and city, they have primary services that they offer, but I don't want to say the majority because I don't know a specific number, but a large amount of the services are not primarily offered through the county or the city. It is outsourced to a third-party organization, right? So there's some things that the Health and Human Services Department may do. They may do immunization. I'm just giving an example. But there may be another program with wellness or with birthing centers that they don't do that. They partner with another organization. So it's just a matter of making the connection of when partnering with these third-party organizations, this is what you need to begin to mandate from them in their reporting so that you can also track the level of success and the outcomes that you want to see as a government agency. Because I believe that they should have a measure, hey, this is what success looks like. Now, they indicate that that's identified in their RFPs and the contracts that they build in, but how much do they go back and assess that, and what does that look like? And that's across the board. That's both with education with the grants being funded, that's in health and wellness, and in some of the other areas, especially also economic development.
We have about 20 minutes left, you all, for this portion, and I know Dr. Carter has 2 more sections to get through. So if you have additional questions, the survey would be a great place to put them. You write them down, but I do want to make sure we get through the remainder of his presentation.
Okay.
Thank you.
So we're gonna,
I have one question.
yes.
Can I fire everybody and start over?
No, I wouldn't recommend that.
Okay.
That's
the way I'm feeling
That's not gonna be the solution. Okay? That's gonna create a problem. All right, we're gonna jump into our recommendations. So we have, from our study, we have 108, actually maybe 110. We're still in the process of editing. But we have 108 recommendations from the 30 metrics that we assessed across the 7 impact focus areas. When we were here the last time, we discussed what our thematic key harm observations are. We identified that there were 4 major issues. When you put everything together, thematically, what's consistent across the board with all of them, respectively. And there are 4 of those that we have identified. And we've mentioned these before. I'm not going to mention them here. There's insufficient data-driven practices to determine the level of African-American participation in county and city opportunities, right? And we've talked about that before. Number 2, there's insufficient evaluation practices of grant recipients, right? Which still carries over from number 1. Number 3, there's limited affordable housing supply for purchase or rental across the county and city, compounded by, this is the important part in our assessment, compounded by a lack of cohesive strategy among county and city officials and key stakeholders. And then the fourth harm is there's county and city governments staff lack wide-scale racial equity training to create baseline knowledge of equitable practices. There have been some training within both the county and the city, but it's not wide-scale enough. Again, if we're looking at cease and harm, then a baseline of everyone being trained and having a clear understanding then informs how we create data-driven practices, which then informs how we evaluate program effectiveness, which then informs us whether harm or not is being ceased. So I'm going to bring up my colleague, Dr. Wiggs, who was not here in person with us the last time, but she is the project manager on this project. So all of this work that you're seeing being done, she is the other half of the brain that's also managing the team. And she was also the lead expert for our economic development IFA assessment. Dr. Wiggs.
Good evening, everyone.
Good evening.
So we talked about our findings. Let's talk about what the recommendations look like. What are we recommending to kind of help kickstart this cease the harm process, right? So what you will see in your presentation packet, there's going to be kind of a summary. There are 10 findings that we are going to talk through today. We don't want us to give you all 110 of them tonight. So when you get the report, please read them because I think there's a lot of good information, great recommendations in those in that report as well. So I am going to cover the first 5 recommendations, and then I'll have my colleagues kind of follow with the remaining 5 recommendations. The first one is to designate legacy communities as historic districts in response to urban renewal. So here what we're saying is, as a historic designation, you get legal protections and regulations that safeguard the community from gentrification. You attract visitors and stimulate tourism and economic development. You're able to qualify for grants, tax incentives, funding programs for historic preservation and revitalization. And then it contributes to social equity and justice by acknowledging past injustices, promoting racial reconciliation, and empowering marginalized communities. The next recommendation that we have is to increase jurisdiction or oversight linked to school district funding. Here, what I'd say is we want to create accountability, right? So as it relates to requirements for faculty cultural sensitivity training, requirements for culturally relevant pedagogy in textbook selections, and then requirements for core subject faculty members to reflect the student demographics that they serve. And third, we'll go into economic development. Develop a procurement industry and utilization dashboard. What we mean here, if you've seen usaspending.gov, there's a open source data repository that's used that provides transparency in how money is being spent within the government. We are recommending a similar type setup within Buncombe County and the city of Asheville. So you're able to project procurement opportunities and track government spending in specific industries and sectors. Implement a user-friendly search and filter system that allows business owners to identify relevant procurement opportunities quickly. And it encourages readiness and competition and promotes vendor engagement in the procurement process. And then fourth, this is not necessarily something that we are saying that the city and county does. This is a community-led effort. Establish a Black Chamber of Commerce. With a Black Chamber of Commerce, there are many benefits that come with having a Black Chamber of Commerce. There was a study done by the National Black Chamber of Commerce that said that Black-owned businesses that were a part of a chamber or a Black chamber indicated that 80% of them found that their business grew from a previous year. So having that support and that collective activism is beneficial. It provides tailored support and services that assist Black-owned businesses at various stages of development. So that's not just established businesses, but it's also startups and those that are experiencing growth as well. And the last one that I will cover is conduct a Buncombe County disparity study. And so here we want you to evaluate historical procurement data to identify any disparities in contract awards among different demographics, especially focusing on minority-owned businesses. Develop race-conscious goals and policies. So based on the study findings, develop clear and measurable goals and policies that address identified disparities and promote diversity in the procurement process. And then develop strategies for inclusion. So actively include minority-owned businesses in procurement, including mentoring programs, capacity building initiatives, and targeted outreach efforts. And Ms. Hibbert is going to cover.
Hello again. So I wanted to cover recommendation number 6. This one is actually very close to my heart. I hope that as a recommendation that Buncombe County, City of Asheville establish a Black Health Directory. This is a comprehensive directory showcasing Black therapists, doctors, nurse practitioners, just any holistic providers that are of African-American descent. This will increase the visibility and accessibility of Black medical providers to the community. It will help with relatability. It will help with primary care and preventative care for the Black community. And it will make it easy for Black residents to find providers that look like them so that they can feel safe within just getting healthcare and finding someone who cares about their health, like family would, so. And Dr. Carter will present the rest.
Are we gonna, any questions so far? So you're familiar?
We'll wait to the end
Keep
for
going, Dr.
questions.
Carter.
Okay, you're gonna wait till the end, okay, all right. Implement skills assessment in form of measurable scenario-based recording training. If you all remember, Dr. McDaniels, the police officer, when he was here the last time, the retired sergeant. So he talked about training and it being measurable. What that looks like is it being recorded on film, and it's, if you're an athlete, you know, they're recording, and you go back and you watch them. So that this type of training is intended to assess implicit bias in a different kind of way, other than just sitting in front of a classroom being taught about it. It's scenario-based, it's recorded, and then it's assessed. And that helps officers do a much better job, realistic job of addressing their implicit biases. We've talked about this one before, number 8, when we say hire a contract education subject matter experts. So specifically looking at the county, when we look at early childhood education grants, and if we're also looking at the city and their strategic partnership grants that are education focused, how are you assessing those? So the recommendation around that is use an expert to assist you with assessing those. And I believe the county has a committee that helps to look at those grant requests. So we talk about using a subject matter expert to either help the committee shape how they're assessing those educational outcomes, what they should be asking for. Because again, how do you measure the outcomes if you're not putting in those proper steps right, to ensure that you get that information on the back end so that you can measure it properly. For the county and the city, when it comes to their internal process, there's been conversation about making revision to their interview process and moving it from an interview panel to what is called a search and screen committee. The point there is that we want to create more distance between the role of the hiring manager and them, and the front aspects of going through applications and making decisions. The point there is to remove bias, infuse other people in the process as you get ready to make those hiring decisions. And that recommendation, again, with the county and city, they will need to determine where does that start, right? At what position level does that start? Do we need to do that for entry-level employees? But our recommendation is possibly around where those who have supervisory responsibilities, right, that we begin to look at how we bring those people in and reduce and eliminate bias. For the equity offices, we strongly recommend that you all begin the process of employee engagement with a survey and assessment of staff sense of belonging, their level of psychological safety within the organization, and just their overall experience as an employee. I believe the city has already began that process, but doing that, because according to our findings, that has not been done in 5 years, and I believe for one entity has not been done at all to anyone's most recent recollection. The remaining recommendations are additional recommendations within each category. So for criminal justice, improving recruitment strategies to proactively include a more diverse applicant pool of Black detention officers. When we look at Buncombe County Jail and we look at the demographics of staff across the sheriff's office, we saw that when it came to detention officers, that the percentage amongst Black detention officers were low. However, right, guess who happens to be high? It will be those who are incarcerated. In education, to conduct a full-scale equity audit to assess academic achievement outcomes for students in grades K through 12. And we know this was a little bit outside of our scope, but we did look at the data for the K through 12 education system. And we felt that the best way to begin to address that issue is to get the data on what does equity or disparities look like in those spaces between the school districts here. For health and wellness, obviously develop a more robust data-driven practice that goes across the board for all of the IFAs. One of the commendable things about the county's public health website is it's very expansive, it's extensive, it has a lot of information on it. They also have a DC alert via Code Red where you can register give them your phone number and it will give you updates on emergencies. So we're recommending that from a health perspective that they add a category for health so that if there are any health emergencies, that you could also get that type of update under the Code Red alert system that they have. Also looked at transportation services for expectant Black mothers, ensuring access to prenatal appointments, birthing classes, and hospital visits. And then under housing, in housing, what we tended to see was there is an affordable housing plan. I believe that the city is currently updating. There are affordable housing plans that the county has in place. There are the Bones report, there's this report, there's previous reports that we read from before, but there doesn't seem to be any collective, this is a joint situation, a joint matter that is addressing the matter of housing. So what does a partnership of county, city, and other stakeholders look like in order to address the housing issues that are taking place in Ashville and Buncombe County? The internal workforce is establish a data reporting of key HR metrics. And what that means is everything we said about, well, that was shared earlier about health and wellness and data tracking and important metrics to look at in order to determine certain outcomes, take all of that and apply it to the internal workforce of the county and the city. How is HR tracking those any specific metrics in order to determine what is the sense of belonging, what is the level of value, what is the level of respect, what is the level of engagement amongst employees. So they too need to do the very same thing for their internal workforce, both county and city. And for the Equity and Inclusion Office, we talked about collaborating with HR or an external firm to conduct a racial equity engagement survey. So that actually still goes back to the one that was shown before. And then racial equity training for all, which goes back to one of those 4 key observations that we have, right? The need for racial equity training across the board. And I think we got it.
We're gonna take 5 minutes for questions, you all.
Can we clap?
MZ, I see your hand.
Yes,
Yes.
MZU, thank you. My question is around representation. I saw the part about the directory, and then I saw the part about criminal justice. But what about the other areas? Did you see any issue in representation? That's one question. And then the next part is meaningful representation. So because you have Black people in the ranks, how are they being included in decision-making? Did you see any issues in any of the areas you looked at? Because I didn't see any discussion around that.
On the downside, I think you're asking a question on the positive end. Unfortunately, when I think about other issues of representation, criminal justice comes to mind. Stops and searches, there's an overrepresentation of Black people being searched, right, in that data. And that's articulated out in the report. In terms of positive type of representation, the closest to positive representation that I can come to will probably be with health and wellness. Health and wellness, they have their community work, their community health workers, their community fairs. They also have the mobile unit. And I believe about 240 times the mobile unit has been engaged over the past 3 fiscal years. We know that a lot of those have been they've been requested and they've gone into particular neighborhoods and certain populations. So I think there's a lot of representation of the service that's being provided. However, they've not been tracking it. right, as effectively. Now, they do have a tracking system. They have a CR, HER, I believe is their process, is the name of their tracking system. So they do have a tracking system, right, but we were not able to get to the data. We didn't get the response on what the data is in the tracking system for who they've been serving, but we believe that there's positive representation there.
And also the question is about like staffing. Did you look at staffing levels, Black
Yes.
staff compared to others?
Yes, we did. We looked at Black staff and the levels of them, of who they are in the organization. And on the positive note, the staff at both the county and the city, in terms of the Black ratio of staff in contrast to the population for the county and the city, and that was aligned. So there was not a problem there. Where we did see an opportunity was there's an opportunity for more Black staff at the managerial level or the supervisory level was one of our findings that either the county or city should take into consideration.
Thank you.
Dr. Carter,
Yes, Steve.
I do have a question, and I just need to, from what I saw of the last disparity study that the city did, indicated there was 0.5% of participation. And what I noted in this study was that there seemed, of MBE participation, there seemed to be about 0.1%. Is that correct now?
Oh, you just threw them numbers at me.
MBE participation?
You just threw them numbers at me.
I'm so sorry. It's just, it is.
I would have to, I don't know if I have a direct number on that, but we know that it's low and it corroborated what was already inside of the disparity study.
And then the other thing, in just being transparent, MCCF fund, I've been there since the inception on the operating committee, and I saw your recommendation. But just know that people who look like me face very collateral damages when we raise questions about data and accountability. In a lot of ways, we are ostracized, we are ridiculed, even though our knowledge base is just as clear as it can be. So that is another issue that we face, not only the lack of data, but also the isolation and the treating as something as the other. So I don't know how we overcome that, but that is something that we just need to speak to, irregardless of ability. And I want to thank you for coming in here and doing a masterful job. Thank you very much, you and your team.
Thank you.
One more
Dwayne,
question, last question.
Dwayne.
I forgot my question, but my question was, I know there was a lot of policy initiatives prior to this, and did y'all calculate the existing policy goals that was trying to address these similar issues? And if you added up all your research, added it up across all the departments, what does it add up to as far as providing the direction we need to stop the harm, and then not only stop the harm, but improve the conditions of the African-American community here, and towards reparations and after reparations? Man, you understand?
I do understand your question. I think you asked an amazing question. My answer to your question is what I see in all of what we've looked at collectively. I see an opportunity. I see, and I speak from a very optimistic, right, problem-solving, solution-oriented perspective, is I see a lot of opportunities that with proper training, with proper leadership, and with the right attitude, people who are in tune to doing what they consider is fair and just, right? But collective, as part of that collective process, I see a tremendous amount of opportunity where not only do you all make history and are groundbreaking in just passing the reparations, right? But in actually leading the country in how to actually implement and make these type of shifts and do it collectively between city, county, and community.
You really see that?
I see that. I do. I see that. I see that because at some point, South Africa and through apartheid right? They were able to move through their process. And not that it's things, but they had to move through it, right? And other parts of our countries, right? Other parts of our community, conflict is a unitary process. It is individually based. And if people can understand the importance of resolving their inner conflict, then it does begin to permeate an energy that allows us to begin to work together and build inclusive community. So it's possible. And I have to stand on that.
Right.
I'll get up for Dr. Carter one more time. Thank you so much.
And thank you to the team.
Yes.
Thank y'all for being here tonight.
Perfect. We are going to continue on moving forward. You all just know that this was a presentation of the report. There's a full report for you to read through that will be shared. And so it is a lot of pages. It is a lot of reading. But if you have questions, the answers may be actually in that report. This is just a slide deck, but there's a very, very robust report that I want you all to take your time to read. Okay, we are going to now move to the Health and Wellness IFA presentation.
I'm not presenting tonight. Good evening, everyone. My name is Joanna Greer-Nikichin, and so we are about to go through our impact focus area for health and wellness. The purpose is to share health and wellness recommendations and receive input from members of the CRC on creating unified recommendations across our IFAs. And before I go further, I must also acknowledge our commissioners, Ms. Renata Connors, Ms. Norma Baines, and my co-lead, Ms. Dionne Greenlee, for all of their hard work. So we have over 10 recommendations, but we're going to focus on 4 tonight. But in all, we're going to briefly state them. No cost insurance, to establish healthcare subsidy fund, comprehensive multi-generational access, increase the number of African-American health providers and practitioners and complementary staff, meet the health needs of African-American elders, payments for years lost by establishing a resiliency sabbatical fund, develop and fund Ashville Black Mental Health Network, establish Black Joy Fund to support joy, wholehearted, embodied spiritual and soul health, hold institutions accountable to address harms and create policies that are restorative, create environmental justice plan, and remedy the harms against Black birthing people and infants. So the ones we're going to focus on tonight will be the no-cost insurance, developing the fund for the Ashville Black Mental Health Network, payment for years lost, resiliency stipends, and establishing Black healing and birthing centers. So no-cost insurance. This is important. It was brought up in earlier conversation because unaffordable access to care, while access is compared, care has improved for Black Americans between 2011 and 2020. Disparities in affordability of health care between Black and white Americans still persist. So we are suggesting that we provide access to Black physicians utilizing direct primary care as one of those interventions by establishing a local health care subsidy fund that will offer subsidies for community members without or having inadequate health care for their needs to be seen by a Black primary care physician utilizing direct primary care. There are currently 2 practices in Asheville that have Black physicians that offer direct primary care. So we are requesting that a fund be established of $1 million per year, renewable annually up to 10 years initially, to serve up to 1,000 individuals with annual coverages between $800 and $1,500 per individual. Again, that goes to the cost affordability ranging on the age of the participants from adolescents to adults. Also, to advocate for a North Carolina state subsidy, there are 9 states that have state-funded subsidies available in addition to federal subsidies with specifics that vary from one state to another. Next, fund and develop an Asheville Black Mental Health Network. So having insurance or money to afford counseling and other mental health supports and other issues that are exacerbate the problem, once a counselor or therapist is found, you then need the money to pay for that therapy. The cycle continues to harm our Black residents and adolescents. So our solution is to develop a Black mental health network and cover the operating costs for the first 3 years. Startup costs would be about $343,300, which is $93,600 per year for the first 3 years. We would ask for a hub station space, could use a community spaces that are already established or make space within the buildings of the hub suggested by the CRC. Partner with local universities, provide free degree through established endowments and link it to working in the hubs. Work with a local nonprofit or interested groups to develop a directory of Black therapists in Ashville. Currently, only 35 Black therapists are currently serving the Asheville community. Payments for years lost. Resiliency Sabbatical Fund. Decreased life expectancies with African Americans are due to economic disparities. So we are suggesting that we establish a resiliency sabbatical fund. Create again, $1 billion annual revolving fund to provide annual resiliency sabbaticals to residents up to $10,000 annually based on their number of years residing in Buncombe County. Resiliency sabbatical funds will be allocated to legacy neighborhoods to disperse to the historically marginalized individuals that have experienced inequities, living communities adjacent and in adjacent housing communities that are a part of their annual programming and activities as members and participants. These sabbatical opportunities will be applied for to conduct family or personal restorative resiliency retreats, wealth building plans, etc., as decided by the recipients on an annual basis. Finally, supporting Black healing and birthing centers. There's no single solution to the fact that Black pregnant women are dying at 3 to 4 times the rates, while white ones are around 60% of all pregnancy-related deaths are preventable. These numbers don't even encompass the Black people who are injured or traumatized in birth. Remedy against the harms of Black birthing people and infants by supporting doula programs and funding Black healing birthing centers. This is one that I want to pause at because there are some statewide initiatives that can support this. House Bill 421 passed on March 21st, 2023, that appropriated $50,000 to change NC tracks to add new coverage for doula services and enroll providers for the coverage effective July 1st, 2023. This one is a little more close to home that I think we could try to see if we could replicate. Senator Natalie Murdoch co-sponsored a bill aimed at improving the equity before birth and mommy. In July the 1st, 2021, the state legislature appropriated $250,000 to mommy, who is like akin to our Sisters Caring for Sisters. So there are models there that could actually at a state level also support this work. So what is a roadmap to get to our impact? Comprehensive health and wellness community assessment. We have many, don't we? Community health and wellness campaign to share findings and solutions. Invest in current. I'm going to say current because we do have a lot of current underfunded and or new programs that work that are BIPOC run, led, and fueled. Also looking forward to resilient community that prioritizes health and wellness. And now I will take questions.
5 minutes for questions. Go ahead, Dawana.
I just have one. I think I was looking at, as you read, the establishment of resiliency sabbatical funds. Is there a reason that there is just legacy neighborhoods and not also inclusive of our public housing communities?
So that's
populated?
Down further, when you look at the next line, it says to include those adjacent housing communities. So that does include them as well.
Any other questions? Go ahead.
Lasandu McPeters. I like the recommendations on the Black Mental Health Network. One of the things that I think we can all speak for is that the education of healthcare and your benefits. Most people don't understand that. And so while I think it's good that there is a hub location idea, I think that it would be very valuable to also include some kind of support where people explain to people how benefits and how your actual healthcare does work. I mean, I know some people do not have actual healthcare, but for people that do, it's tricky. And nobody really ever explains it to you, your employers, providers, et cetera. So I think that there's got to be a component that goes deeper into making sure people understand how your benefits work, whether that's going to the hub, to the communities, or to your employers itself. I think we have to include that in the recommendation.
Thank you. And we also agree because we know that we can utilize our community health worker force, our nurses that are also community health workers, and expand those networks, because we already have people that are doing that work in underfunded capacities. And so if we were indeed to make sure that that money was given to those individuals, again, that's why we said established. So working with the things that we already have, because we have a depth of resources and talent in Asheville and Buckingham County, but also being open to emerging opportunities for us all across the board. But thank you. Dwayne,
I didn't see, I know you mentioned something about environmental justice, particularly in our communities. How does that play? Where is that in that lineup? Especially, I know you were referencing policy goals from the state level, and there's that Inflation Reduction Act. And it's specific monies dropping down from the feds around
yes,
environmental justice and funding to
and it's called TIC-TAC.
all the
And so TIC-TAC is again another one of those opportunities that we would be able to tie into for that funding at the state level. And actually, it's really unconventional in that some organizations can collaborate to get that funding, and you don't have to always be very established. We have some great partners across the state that are doing that type of work. The North Carolina Black Alliance, as well as NC Counts, they all have opportunities for us to plug in. So that's another one of the things when we talk about establishing a environmental justice plan. Those would be entities that we would reach out to get that support, because again, there is a lot of funding around it, and we have not done enough focus on it. And sometimes I know as a people, we take environmental justice as a privilege, right? Sometimes we don't have the privilege to think about our environment until something goes wrong. But this is one of those states that I like to say we have to have a sense of urgency before the emergency. We know that there is global warming and everything else going on, but we don't have time to take the time to look at that. But this would actually give us a plan and an opportunity to focus on it and to pour into the community while we're doing it. Another opportunity too is when we're talking about the gaps in data. What about, again, utilizing our community health worker force to provide that data, as well as investing in community-based participatory research of researchers that we train from within our ranks and pay them to do the research that we are doing for community instead of bringing outside people all of the time. Yes, we do need to have that outside look, but internally, we also have the opportunity to build a workforce.
Tiffany Debla.
I have a two-part question. First, thank you for this update and your recommendations. I love the detail, and I love how you put the numbers in and connected it to the state level, and what's happening around the state. My question is just around the no-cost insurance. I think it's really great, but I just need some clarity. So you're talking about a healthcare subsidy fund. Is there a difference between this fund and what, say, for example, our health centers provide?
Yes.
Okay.
So this will be additive, because we know a lot of times the access that people have is not enough. And it's not also centered in Black care. And so we do know that we have Black physicians, but that's another data point for African Americans, practitioners or physicians in Asheville, Buckingham County, there's only 1%.
Yep.
And that was the same in restoration, like in 1930s, 1940s, the same amount of people, practitioners of color that are serving now. So one of those, again, is investing in making sure that we're able to incentivize practitioners of color, but also grow our own. But again, when we're talking about direct primary care, that is another way to make sure people have direct access to physicians. They have more time because direct primary care is not on the clock. You can have as many visits as you need. And so it's really as a supplement for those people that aren't getting Medicaid or Medicare, and or for those people that are getting those services but are not receiving the quality care that they feel that they need.
Ooh. And my next part is would your IFA be also considering the recommendations from the Cease the Harm report?
Yes. But it was very encouraging that a lot of the things that we've talked about in the ones we presented today, as well as those we haven't talked about, have also been presented on the screen previous to this. So we know we're in line with what needs to be done.
Well done, thank you.
Thank you. Joanna and then Jessie Ray.
So it's, I'm actually looking at the no cost, and I like the requesting that the fund establish that, year, but also the cross training, to really incentivize our education, but I see how it ties to the education group. And, one of their recommendations around that, training of mentorship and training of our Black youth into these different fields. So I see the tie-in. I think it's so important, and I just want to highlight that. That is super cool. So thank y'all.
Jessie Ray.
Yes, Jesse Ray. So would the healthcare subsidy fund just go to Black physicians, or would it go to any physician that would agree to provide primary care to those underserved?
The idea here is to support Black physicians to give that quality care. It would not be exclusive. We can never say we would not give it to anyone. But if there was someone that would like to participate in the program that is culturally competent and responsive, that has been through the training, and that we know they have not historically participated in harm, then they will be welcome into the fold.
Okay, and the second part then, if could they also receive funds from the healthcare subsidy fund as well as charge Medicaid for that same care? In other words,
well, direct primary care does not charge Medicaid, and that's why that model is a lot different. It's direct pay.
so that would be the only compensation they would receive for the
Yes.
care.
That's correct.
And then would that be based on market rates, or?
Each of them have their own rates. If you, in our recommendations, you'll be able to go to the links for each of the two that exist in Asheville, and you have a block rate for your age category. So say, for instance, if you had a child that you want to participate in direct primary care, it could be $85 per month for that child to see that physician. Unlimited access.
Wow, that's so.
Thank you.
We have Jessie Ray, do you have any more questions? Okay, we have MZ, then Joyce Harrison, and then Mr. Roy, do you have a question? Okay, sure.
Thank you. Thank you to the IFA for the hard work on this. And my question is just about life insurance. You see medical insurance. Any idea about life insurance?
We had not breached that idea, however. But we do have a lot of people that are life insurance carriers. And so again, thinking about how and I want to almost take my other hat off. How do you intentionally invest in business that you know is taking care of your community? And I think that's something that we as a Reparations Council also need to model as we do our investments.
Great.
Ms. Harris?
Joyce Harrison, are you willing, is this program looking at even physicians outside of Buncombe County that your clients could go to? Because we do have some Black physicians in some of the outlying counties that could possibly participate in the program.
Sure, that wouldn't be an issue. The issue would probably be transportation. However, we have also talked about in other IFAs as well as ours, making sure that we have something that is outside of our regular mountain mobility that gets people to other places. A great opportunity now is if people are enrolled in Healthy Opportunities, which is managed Medicaid, they can actually get transportation to doctor's appointments or to Reparations Committee meetings. So it's just knowing those resources that are already established and how do we leverage it to go further.
Any other questions? Oh, Mr. Roy Harris.
Well, we can't do public comment right now.
Public comment, we can't do public comment.
Yeah, at the end we will though. Open it
Go
up.
ahead, Mr. Harris.
I guess this is an overall question. Dr. Carter, when you finish with this, we already know the bad numbers. We know every number. Are you going to be able to tell us what we need? Because you said with lack of gathering data, will we be going through this 5 years from now? How do you help us there?
I would recommend that a study like this be completed within every 3 to 5 years, right? So that would be an average of 4 years. And then, but you also have some steps in between that, so you don't have to wait, right? So just like how you have a disparity study, I believe that's done every 5 years, depending on what the rules are. So something similar along those lines. And that's where the Oprah conference, I think, does an amazing job. It provides a methodology for you to come back and to test again the same areas, and it has validity because it will be consistent in giving you proper numbers and giving you a proper assessment.
Thank you.
Perfect.
But Mr. Harris, can I come back too?
Yeah.
I would suggest that you invest in establishing a community-based participatory research firm locally that you
Yes.
ensure does this work.
Yes.
Thank you.
Say that again.
Hello, Mr. Wana. Are there any other questions? No? Can we please give her a round of applause? We are going to shift to our community engagement reports. Before we do that, I just want to take note of the spirit of this space. We're doing some really great work, y'all. When I came back here, when I came here in October, the spirit was very different, okay? And I just want to give y'all some love. I just appreciate how serious everybody has taken this, how we have set aside a lot of the conflicts, Dr. Carter, you mentioned. And we're actually talking about things that change the system, which is really, really, really important. That's how we will sustain this work. So I just want to give y'all some love. I am proud and inspired and honored to help lead these conversations. We had 2 extra minutes, so I wanted to give it to myself. To give y'all some love. So I'm gonna turn it over to, yes, you do gotta go up there. Maybe go up there last time. So we're gonna hear from Dawana about the progress of the Community Engagement Committee.
Hi, everyone. So some quick updates. We have met, the Community Engagement Committee has met 2 times since our last meeting, and they have been very, very productive. I'm super excited about the committee, and thank you all who participate on that committee. There's a mixture of commission members and community. And so it has been a great experience. And so with that, as you can see, this is our report that we will be giving out every meeting. And so the numbers have changed, but this is the template for it. And so get used to seeing it. So we have had 2 community meetings, 4 attended events, and we have engaged 57 people since our last meeting. So, and that's not the 11 meeting, our last month meeting, just to be intentional. We don't have any data on completed surveys. We're still working on that and getting that up and ready. And no data at the moment of neighborhoods reached because both of the events were city and county-wide events. So we had a mixture of everybody. So that is our update.
Can you read the quick updates, Dawana, to give a little bit more context to the numbers?
Okay, 19 members are active on the Community Engagement Committee. Small delays with events due to compliance and operational details. Community engagement tool has been drafted in partnership with city and county. New community engagement flyers have been drafted in partnership with city and county. Committee has reviewed budget. A calendar of events and sign-up form has been developed. The committee has defined roles and prepared a script for engagement. And scan the QR code. Is that active?
That's active, yeah.
So the QR code is actually active, and our approved budget, as y'all know, thank you all to the commission, is $65,000 for this engagement. And we have a detail that should be in y'all's email.
Yes.
List of attachments for this meeting. So please look at that and vet it. If y'all have questions or concerns, please show up on Thursday from 6 o'clock. It's virtual, so you can do it anywhere. For our community engagement meeting as we keep moving forward and doing our planning. If you look in your packets, there is a calendar of events for the next few months. And y'all might have events that might not be listed. Please email me, Venetia, and Blah with those events so we can add it to the calendar. One thing we do want to do with this community engagement is not just on the committee itself, but on us as a commission is represent and show up and be there at different events to represent and talk about reparations and what that looked like and gain the feedback. So please let us know, and will you handle this next?
Yeah. You all will get this report emailed to you after today, and we'll try to make sure it's printed for you by the time we have this meeting. That QR code, when it's scanned, it sends you to the link with all of the events on the calendar. So if anybody wants to sign up and participate or be present, you can just fill out the form there. And you'll get communications around the events that's happening with the Community Engagement Committee. Question, yes, Ms. Harris.
Ms. Little, you used the word very productive. Could you define that a little bit better for me?
So our meetings have been based on like community engagement, what's happening in our community, what is known, how do we show up in community, also establishing our committee and those roles that are within our committees, also including community and what that looks like, and how do we develop scripts and things like so that our full committee can be informed as we go out and engage, because it's bigger than just us that's a part of this commission. And when I say productive, the work get done.
Mhm.
Like there's no it's great meetings, and anybody else that's on that committee can speak to it's very productive. The work is getting done, and it's getting done very fast, and that will lead to our next part of community engagement. But I'm gonna let Tiffany speak to the productivity.
So I would also say that it's multi-layered. It's participatory. When we had the first meeting, we established, as Dewana said, the roles, but it wasn't just being talked at from, the facilitators. It was also us as a community collectively, really speaking in terms of how we really are gonna engage in person with individuals that's in our community. But then it was just a layer of talking about offering some virtual options. How do we connect to our elder population? Making sure we're not leaving out our youth, but most importantly, our housing community. So every question that we asked, it was just this transparent way of answering it, especially about how we can stay involved, get more involved, and then keep inviting those who can't make it to come, because it's not just a one-off time you're coming. Last thing I want to say also is the calendar is fluid. So I do appreciate Dewana's hard work in that, and Anisha, but the calendar is fluid. So that means that if you have activities or events that may not be listed, please share it. And also, if you're seeing things here that might be, if you have a feeling of it, it's open to your interpretation and open for you to give feedback. So please give the feedback, but also please show up to some of the things that you can. And don't feel like you can't because you don't sit on the committee.
So are you sharing the information about defining reparations at these meetings? Are people understanding what the reparations process is about?
At the committee meeting?
At the committee meetings?
The committee meeting has been made up of mostly everyone here. I would say,
Yes.
yeah, I would say that is being addressed, but
Okay.
since you bring it up, I think that's something to also include in the script.
And the reason I'm asking that question is because I've had some conversation with people outside of this room, and they're still confused about what reparations are. So that's why I'm trying to make sure that you're saying what you're saying at those meetings is the same thing that's here, and that we have been working from at the same time.
And
Okay?
so we haven't had any input sessions, just with community. This has been planning and committee meetings that has happened since our last meeting.
Okay.
So we have not actually went out into community yet, but that will definitely be a part of that conversation.
See, Ms. Joyce, you need to show up to the committee meeting.
I'm trying to
To be giving this feedback.
Well, can I just add? We're kind of like on the back end, where we should have been on the front end. So we're trying to do fast tracking of what we're doing. So we did not have the opportunity to sit down and talk about a script when you go out. I think that we had maybe
Started it.
3 or 4 people that were just community people that wanted to be involved in that, maybe 3. And we have not gotten to that of the stage of when we would go out and what would have to be said. But we've already addressed the fact that we'll need a script. And the script would tell, because I've started to say when I speak to people, when you say reparation, then I always say stop the harm, because they're not understanding what reparation means. And so you have to let them know that the engagement of there was harm that was done. So they have to understand that part, especially if you go into areas where younger people, you have to understand there's a lot of people that are not originally from Ashville, so they don't know. So we haven't gotten there. The meeting we had, I think it was just an adjustment of knowing who was in the room and how we were gonna go past who was in the room.
Okay.
Yeah, great discussion. Any other questions, comments?
Yes.
Okay, y'all, we going early.
Sorry. Just go watch the vote.
Oh, yes, I'm sorry.
Oh.
One thing that did come up in the community engagement committee meetings, we wanted to pose to the group if you all would allow this committee to make decisions when it comes to community engagement on behalf of the commission. Things such as what flyers are we using? Which vendors is being selected for, the different events, right? If the committee does not have your permission to make decisions on behalf of the full commission, then that means that this committee will have to come back to you for every single small thing that is done. Vendors selected, flyers chosen, things of that nature. So we just wanted to get buy-in from you all to give permission to this committee. Remember, 19 members are a part of it, but just wanted to get an official vote and approval that you all are comfortable with the committee making decisions using the $65,000, designing the flyers, things of that nature, working with the city and county on behalf of the commission. Dawana, anything else there?
Can I add something?
Go ahead.
Madam Vice Chair, and just remember that you all have done this before, because when you hired Dr. Carter and his team, there was a group of you from this commission that got together and were a part of this RFP process to bring on the Carter Development Group. So you've already done this before. You entrusted them to make the decision, and we got the awesome Carter Group. So just want to put that out there.
So we're just making it official for this committee.
Yeah.
So you
So,
wanted to make a motion?
yes.
So moved.
I second. So moved by Joyce, second by Bobette.
Thank you.
All in favor, raise hand.
All in favor?
Raise your hand.
Any opposed?
Any abstaining?
Right.
Okay.
All right, the motion carries. Thank you all.
Thank you.
All right, you all. Now we are going to move into the prioritization refinement tool. So that is myself, Salah. You come from Northport. Okay, you want to start?
Sure.
So first of all, this feels like I'm loud tonight. Thank you all for your feedback and your comments about refining the tool. We appreciate it. We took it back to our teams, we talked, and what we have come up with is the community engagement tool that will be used by everyone. So for the community engagement, going out into community, and for you all as well to select from the recommendations, the ones that you find are most impactful, the ones that have the ability to elicit long-term and long-standing change. And so that's what we'll be moving forward with after this point. And I'll turn it over to Venetia.
So just to rehash, last time we were here, the discussion was around a ranking system. It was clear that you all were not in favor of a ranking system because it's really hard to just say that this is number one. So as Dr. No said, the tool that the Community Engagement Committee, you all will be using to engage with community members, it will simply ask the questions of these recommendations, which one do you feel is most impactful? Impactful meaning which one will have the greatest change, right? And to Babette's point, stop the harm. So that is the feedback that you will receive from the community. There will also be a space on this tool or survey, we can call it a survey, survey that will have space for people to just put their thoughts and comments, right? But the goal is to get some type of input from the community members based on what you all have already drafted. So when you all are preparing to submit these final recommendations to the city and county, you can say, here's what the community members said. So this tool is designed to capture that. Let me pause. Does anybody have any questions on that? Yes.
I don't know. In our IFA, we didn't go back to slavery time. We didn't go back to try to measure and count the harm from slavery all the way up. I think mainly our recommendations focuses on a certain period of time. So how are we going to count from slavery all the way up to probably urban renewal? Because in our recommendations, we didn't really focus on those earlier dates. So how are we going to make up for that?
I don't think you can at this point, to be honest. If you wanted to go back, that would be a whole nother process that we would have to figure out, but I think we work with what we got.
So that's what we're gonna do. But in the initial resolution, it listed the harms from that period of time to present.
Yeah.
So you're saying that we just gonna forget about that time, and if we are gonna forget about, how we gonna make up for it on the back end?
Yeah, I wouldn't say that we're gonna forget about it. I would just acknowledge that this group didn't do that we focused on whatever it is that you focused on. And that's what we're getting feedback on. I think as long as you can acknowledge and justify why you chose to focus on what you focused on, that's important. And if we do want to go back, we can engage the community in that way. Like, would they want to be a part of, addressing what happened in the past? But I think because we have a timeline, we have a lot of stuff to complete, I think we can only work with what we have. But I think coming up with an explanation of why, this group didn't go that far back, I think it would be up to the IFA group to come up with that type of explanation. Because the community could ask you the same question.
Yeah, but we know some of it because there's a lack of data or no collection of data. So it was, Yeah, but I'm saying for us, so are you telling me right now that we're gonna forget about the most hammer pressure, the most harm, and just focus on the most recent harms? Is that what you're saying to me?
No, I'm saying to work with what you have. I'm stating focus on working what you have, working from what you have. So for example, if there's a lack of data from the past harms, it's really hard for you to come up with resolutions for that. Yes, would you agree? If there's a lack of data, it's hard for you to come up with resolutions for that. You don't agree?
No.
Okay. Let's have a conversation offline. Okay.
I do have a question, because I would like to know from the IFA facilitators or members of your group, how many of you went back from slavery and moved forward? So that is health and wellness. So health and wellness is the only,
We saw
We
that.
took a look at it a little bit in economic development, not in detail, but we did some historical study to try to have an impact of when slavery began in this area. 1739, Jim and Sue, Candler, modern day Harmony Valley. So we're informed, but focus would be lacking in terms of
but the focus
what
was
we
not on,
evaluated, what we came away from it with.
Touched on it.
okay.
MZ?
Yeah, I'm concerned that the question is still prioritizing. If we're saying most, we're establishing a hierarchical standard. So it just sounds like we're still going back to prioritizing.
Yeah, can everybody look at their agenda where it says prioritization/refinement tool? Can y'all look at that? Y'all got a pen? I need y'all to cross out prioritization. Just cross that word out. Because we're not saying that. Just cross it out.
No, you're not saying
No,
the word, but the
right.
question is still
No.
prioritizing.
Let me finish, MZ. I'll let you finish, okay? We're gonna cross that word out because I don't want y'all to think that that's the word, that we're not focused on that. The question is, of the recommendations that you all have crafted, which one do you think is most impactful? Not most important, not which one would you put number one, but which one is most impactful? Okay, yes.
Why do we ask that question?
We need to have some type of feedback from the community, right? If that's not the question we are asking, what question would you like to ask the community, MZ?
I would like to have an open-ended questions to the community, to ask them what they think reparations should be, as opposed to taking what we've already developed and saying what's most impactful, most important, whatever type of wordsmithing we want to do to it. I would like to value the community's mind to just give their thoughts, as opposed to just giving our thoughts and then still having them rank them. Because that's, although we're not saying prioritization, we're still ranking them.
So my feedback to you would be, knowing that data has been a huge gap in this entire process, one of the ways for us to capture data in the community engagement process is to have them fill out some form of a tool. Now, the engagement sessions that Dawana has spoke about will give space for people to have open dialogue. And even on that survey tool, they'll be able to share their comments in an open text, but we still need to have some type of way to measure or track the feedback of the community. Does that make sense?
Yeah, but there's a way that you can do that without having them prioritize what's most impactful or more important. I think there's a way to do that.
Okay, let's talk about what way that would be.
Yeah.
Okay, all right.
Well, can I briefly interject?
Dwayne.
Yes.
Semantically, whether you say prioritize or impactful or however, semantically, you've not really changed anything. And if what you're trying to achieve is what he's saying, I believe, is an organic response, then you simply take those responses. And then when you're analyzing the data, maybe internally you can prioritize or you can rank, because maybe there are certain things that emerged were more repetitious in thought, as opposed to trying to steer that on the front end. Is that fair?
So that is fair and received. I think it's also still important this is good feedback for you all. This is the work that y'all have done. If we don't give the opportunity for the community to give you all feedback, we don't know how you're doing, right? So this is for you to get feedback from the community based on what you have done. In addition to that, the open dialogue, the open places for them to put their comments, we can absolutely take that and do exactly what you just said. And that's still a form of refinement, prioritization, whatever it is that you want to call it, is still the same thing, right? But you all have done a lot of work. What this community engagement tool is about is to say, based on what you all have done, how does the community feel about that, right? And if you want to continue to have open dialogue, that can be tracked if they fill out the surveys. We can go back and see what commonalities or similarities that is shared in that open dialogue, and that could be another set of data points. I think both should happen.
Yeah. Mr. Jesse, did you have your hand up?
Sort of. So I was just thinking and trying to understand this last dialogue about prioritization or what's most impactful. And if I understand you correctly, you indicated that we would receive from the community what they think is most impactful.
Based on what you have completed, yes.
And we will receive that information. Now, will the committee have the option to, in terms of whatever we want to call it, most impactful, prioritize, realign what comes from the community?
That would be the goal and hope, yes.
Because we have a broader view participating in this process and receiving information from the IFAs, each IFA, we have a broader view of what's impactful. And so if we receive something from the community, again, I'm just raising the question, will we be able to modify or prioritize that particular impactful item? Because our view is much broader than what the community's view is.
Yes, that is the goal of what community engagement should do. Based on what the feedback that you receive, it should inform what you do next. I'll let Salah speak.
So, Mr. Jesse Ray, when the Housing IFA did some community outreach back last summer, one of the things is we brought our IFA recommendations to the community. And what they did was they told us how they felt about it. We went back to housing and we incorporated their feedback. So that is the goal and the hope that as you all go out and we send this information out, that people are able to ask questions, they're able to provide the feedback. One of the things that we said about this commission is that the people around this table cannot speak for all of Black Asheville. So you want their feedback. And that's why we're going out, so we can come back and incorporate the feedback. Now, will we be able to incorporate all of the feedback? I can't say that. But the hope and the wish and the goal is to be able to go get the feedback, bring it back to your respective IFAs, and hopefully refine your recommendations.
Tiffany? So I have it's a question and a suggestion. The question is, did we actually put a number goal to how many community members that we want?
No, that's something that came up in the committee meeting.
And another piece is just a suggestion, as instead of individuals saying which one they prefer, what if they were like, and I don't know if you do the tool, but do they agree with it, and check all that you agree with or you like, or all that?
So that's what we initially came up with when you would scan that barcode, the barcode, it was going to say, do you agree with this, yes or no? But some of the feedback that we have received is that wasn't enough. So, or they didn't want to do that. So now we're at this piece.
May I ask, did that feedback come from staff or community or commission? Commission. Who said that? Thank you.
So here's what I'm gonna close this portion. What I want to do is revisit some conversations. MZ, I'm gonna reach out to you for sure, Mr. Barton, because I want to get to a place where we're aligned. Mr. Robinson, I think as well. No, I'm so sorry.
Richardson.
Mr.
Okay.
Richardson.
I know who you're talking.
Yeah, but I'm gonna reach out to the three of you individually because I want to get to a place where we're aligned. I'm on your team, you know that, MZ. So I just want to make sure that we create something that works, that everybody's aligned with. And I want to stress to y'all, when we say prioritize, I don't even like the word now because of this meeting. But what I'm really thinking about is like, where do we begin? Where do we start? And that's really the question that we're trying to answer. We got a time frame, we got a certain amount of money. So where do we start is really what the question is. So to close this, I'm going to reach out to you all individually, work with Mr. Raphael in the back. He's with the county to help complete developing this tool because these events are happening and we got to get this tool done quite quickly. Any other final statements before we move to city and county updates? Yes.
She's closing, but I'm gonna open up just a little bit. I have already sent you all the survey for this evening. So if you have any questions, thoughts, click on your phones, your tablets, whatever, and please respond to the survey because we are looking at that information and we are applying it to the work that we're doing moving forward. So it's already been sent to you. You should have it in your email. Thank you. For the whole meeting. But it asks questions about every single presentation, so it's a little longer, but we really want to hear your feedback. Thank you.
All right, y'all, we gotta say city county updates.
And so,
Yeah.
Natalie.
Oh, sorry.
So Natalie Bailey will come up and the next item on your agenda is to talk about the CRC report writing. I will say that I sent out a survey. We had 11 responses and 7 of those responses or responders stated that they were interested in being a part of the report writing, the final report writing process. And Natalie is going to talk to you about that right now.
Hi, everybody. Again, I'm Natalie Bailey. I am helping coordinate the drafting of the final CRC report on the city side, along with Catherine Cutshaw on the county side. Staff has been working together to come up with a plan for logistics, including a timeline, an outline, and things of that nature. But it is really important to have you all's participation in the event. We have spoken with IFA facilitators. We would like to have commission members be a part of this process as well. This is your report. This is your commission. It needs to be reflective of your participation in the process. And so it's March. In my world, it's already April because that's just how I operate, it's April. And so we are working on a timeline. And so we really need to have you all's commitment if you are interested in participating in drafting the report soon. I don't know, Ms. Manaya Merritt, what deadline would you like to give folks?
So sorry, can you repeat what you just said?
Deadline to sign up, the deadline to sign up.
Oh, the deadline to sign up
Yes.
was, okay, so the deadline for the survey was, I think, last Friday.
Yes.
Let me just pose the question, is there anyone who did not complete the survey that would like to be a part of the report writing? Mr. Richardson? That's Vernisha's fault. Mr. Richardson? Okay, so it looks like I didn't see any other hands, so I will add Mr. Richardson to the list. And so the deadline has arrived and closed.
I'm sorry, Renata, I saw that, but when I went into it, it only said like IFA or commission. When I clicked on it, I think mine said only IFA.
Right, so.
So there was an opportunity for both the IFA facilitators to respond as well if they wanted to be a part of the final report and for the commissioner. So you would check off if you were a commissioner or if you were IFA facilitator. I just needed to know that.
It didn't let me do it.
It didn't let you do it?
So when I clicked the IFA, it just not, I mean, it didn't let me.
Also, are you the one who clicked the IFA facilitator?
That was because that was the only one.
There was only one.
That was me. Because it wouldn't let me click the commissioner part. So.
Oh, wow. Okay. I'm not sure what happened, but I will know and you would like to be a part of the process. Is that correct?
Yes.
Okay. Thank you. I don't know what happened, but
okay, no.
Yes.
Can we also verify that Tiffany signed up as well?
Yes, I can do that. Yes, your name is on there. It's Deborah. Anyone else? I will add you, Mr. Richardson. All righty. Thank you, Dr. Lavender. We already knew. All right, thank you all.
Thank you. So the next item on the agenda is next steps. So I would like to ask the commission, because we had an extra meeting this month, I thought was great. I can't speak for everybody's experience on the additional meeting that we had last week, which was virtual. But, to see if y'all would like to have another additional meeting, around draft recommendation discussions in April.
You want to do it in April?
In April, because we had an additional meeting this month, so for April, would the commission like to have another additional meeting? I thought it was very productive, but it's up to the commission if we do that again for the month of April. It will be virtual, which worked out pretty well.
Can I just add something? So we have one recommendation, I know I'm up and down. We have one recommendation, which is the global accountability recommendation. If you all would like to have an additional meeting, I would suggest that meeting be for that. But I don't know, I'm gonna call you all out by a show of hands, who has read that?
Who has read the global?
Yeah.
If you
Global
have read the accountability recommendation,
So we need you to read it.
Tell the truth.
We need you to read it. We need you to comment on it, because that's one that was presented back in December. We are here in March. It'll be April.
Just updated too.
So we really need to kind of buckle down and decide what we want to do with that recommendation. Just a suggestion.
He said it was in December.
Okay. So also the question is by show of hands, who would be interested in an additional meeting? Just know that that recommendation would be what would be discussed for April. It's virtual. It's so easy.
Madam Vice Chair, I sent out a survey on that, and I think there was like 75 or 80% of the people were like, yes, they would like to have one, but they wanted to make sure that it was more like a working meeting, that we were reviewing recommendations. One of the responses was if we can add time to the back or past June, they would prefer that. Yes. But if not, I kind of know who that was. I'm not gonna call you out. If not, they would like an additional meeting. And I think it was 50% that said they want virtual, 50% said they wanted it in person.
Can we?
Sandra, go ahead.
Sandra, can we really address that though? Like, if we're trying to squeeze in more meetings to finish, like that's just a sign that really an extension, whether we're talking about months and months though, but I mean, like, there's clearly a lot of work to be done within these next couple of months, and we're trying to squeeze in more meetings within this time frame. Like, so I would think that there should be heavy consideration that in looking at it, so for us not to have to squeeze in more meetings, maybe extended a month or so for us to finish adequately.
Right, thank you, Asandu. So this is what I'm gonna say. I'm being recorded, so you can hold me to this. First, you all asked for additional meetings, and so that's why we had that additional meeting we wanted. We heard what you said. We wanted to give you an opportunity to meet again. There's also the possibility of having checkpoints. So what do I mean by that? Let's say we get to June and we have to present to, let's say, City Council. It's a checkpoint. What we want to do is say, in January, we came to you and said we needed more time. You asked us to do the community engagement and then to come back to you. This is where we were in January. This is what we've done since January to June. This is what we need. It's a checkpoint. Is there a possibility for us to go until September? But then we need to know what you're going to do in between June and September. Is that fair?
I mean, one thing to look at too, though, like this calendar for community engagement, like this is packed. Like this could be spread out. This could be spread out for 1 month too. So I mean, like that's one thing you could put on there as far as what's going to be done. Like this is a lot.
So that's what you guys are going to do.
But I'm just saying.
Right. I hear what you're saying, Asante, really. I do hear what you're saying, but what I'm saying is I would love for you all to be able to sit down as a commission and determine, again, what would you do from June to September? What it could look like. And we can work with Bernicia, the chair, to see what that would look like as far as spreading out that community engagement.
Mr. Jesse Ray?
Is the Carter report going to be presented to the city and county before our recommendations, or will it be a part of our recommendations?
So the county is actually, their presentation is tomorrow.
Tomorrow.
And then the city's presentation is a week from tomorrow.
So what if the city and county say, well, we got it? We can't give you any more time because we got it.
I can't speak for the counties. I'm gonna have Dr. No come up, but I'm gonna speak for the city, and there has been some discussion with my supervisor regarding checkpoints. And again, that is you all showing what you've done since January up until June, and then us hopefully being able to say that you can go to September, but you have to help me to help you is what I'm trying to say, right? So if there's something that you need or something that wasn't accomplished during that time period, and you can give us a game plan on how you want to accomplish that by September, then that would be so helpful.
So,
Prior to your question, so, Mr. Ray, to your question, we will not look at the audit and just say we got it and we're done. So the work that Carter Development Group has done has been to inform city and county of where harms have been and how we can make those corrections internally, but also to help inform you all that things that you can pull from your recommendations. We still want to hear from you. We still want your recommendations to come forward to the Board of County Commissioners to then be voted on. So we will not take what Carter Development Group has submitted today, their final presentation, final report, and be like, we're done. So that is nothing to be worried about.
MZ, I think your hand was up first. So, I just feel the urgency of the conversation around like the timeline. And yes, this calendar is very, very ambitious. I'm gonna tell you, because it felt this sense of urgency that we got to June, we need to have this done before June, by the end of April, May, you know what I mean? So it is a sense of urgency that we're all feeling given our timeline and our time and constraints. I like the idea of the checkpoints, but I also want to caution us, like, as we had this additional, hopefully we have an additional meeting for April, so we can start talking about the accountability in a real form as in an entity, because once we establish another body to handle, to progress this process and to hold the accountability and to hold the funds and all of the things, then it kind of minimizes our need to continue to ask for extensions when we know that it's necessary. Because this work will not be done by June. We already know that. If we don't, then we're not being realistic. This work took hundreds of years to get to this place, the trauma, the everything that we're trying to address. And now community engagement and all of the things, it's gonna take longer than from March to June, and even the 2 years prior to this, to get to the real solution and real impactful solutions. Like, I like the term impact. Like, if we just want to throw something out and check the box, so we did it, well, we're right on course. You know what I mean? But that's not what we're trying to do. So I want us to be intentional about, if we go have this meeting in April, and what that conversation really needs to center around. We have a global recommendation for accountability. Each accountability recommendations from each IFA identifies the need for there to be a separate body that holds the accountability and ensuring accountability for the implementation of the things that ceases the harm. So we just need to be intentional about what that next meeting look like if we go do an additional meeting. And even if it's strategizing on how do we get an extension so we can accomplish things we want to accomplish, it definitely, we need to be a little bit more intentional. I feel like we come to this every meeting.
All right, y'all. Thank you, Dewan. Okay, y'all, it's 8:01. And I do want to be mindful of everybody's time. Sorry, MC. But I think to close this piece, we'll follow up. And if there is an additional meeting, you'll hear from Salah about when and where that is. That will be virtual. Okay. Thank you, Salah, Dr. No.
So we do have public comment. And we do want to also be respectful and mindful of the people who signed up for public comment. So I would like to open up public comment. I will have a you have 3 minutes. Everybody who signed up for public comment, you have 3 minutes. We need you to go to the mic and say your name and speak clearly. But you have 3 minutes and you will get, what's your sign for?
Thank you.
Oh, you'll get one of these when your 3 minutes is up.
And a thank you.
And a thank you. When your 3 minutes is up. So Marcel Williams is signed up to speak.
Hello.
Hello.
I'm glad to see as many people out as we do have. And one of the questions I wanted to get an answer to is, if we get some of these things passed, where is the money coming from? Because, you know, it always boils down to the money. And I don't know if the city or the county will come up with the funds to implement some of these programs. Hopefully they will. But in my case, I'll probably be gone home before they will. Because you know, when it comes to us, and you know who I'm talking about, we don't have the funds. And if we don't have the funds, we can't implement anything. So if the committee can find out, and another thing, to prove that you was affected by slavery, what kind of guidelines do you have to come up with to prove? Because any black person can say, my great-great-granddaddy or mother worked in the cotton fields. How am I gonna prove that?
Right.
Now, what are we gonna do about that? We got to have some way of finding out who ancestors really did what they did, and the offsprings need to be compensated. I know in California, they was gone home for reparations, and all of a sudden they came up with, we don't have the money. And then you got to jump through hoops to prove that you was affected by racism, slavery. So the committee needs to come up with answers to that also. I know you got a lot on your plate, but we need to think about that also. And that's it for me.
Thank you.
Miss Priscilla Robinson.
I don't know whose laptop this is.
You can go.
Can I close it? My name is Priscilla Robinson. To all involved, thank you for your time, energy placed in this process. As frustrating and disappointing it may be at times, know that your work is not in vain. Some people think reparation conversations are about slavery only. Some people don't know that all of Asheville's thriving communities of Black people were uprooted. Homes and businesses were taken during the urban renewal implementation, stopping generational wealth. Some owners were given as little as $10 for their property. Some people don't know that the largest concentrated area of public housing is located in the South Side and sits on over 120 urban renewal properties. Some people don't know that the city-owned parcel on Choctaw Street, the empty space inclusive of a walking trail, once held 34 urban renewal homes. Dr. Richard Marcinio of the University of Maryland, Dr. Mian Lee, George Mason University, and I have been working with Dr. MZ and Dwayne Barton. I have come today to present a list of owners for properties taken in the South Side area
the area of focus for our research. The information is extracted from the original massive urban renewal files stored at UNC Ashville Special Collections Library, as are all the files of property taken from Asheville communities of Black people. The list I present today is categorized by home and business owners in alphabetical first name, last names, by streets. Livingston Street consisted of over 100 homes that were taken, business types, and most of those businesses were located on Southside Avenue. And I've also included an executive summary measuring the impact of urban renewal, which unlocks hidden information in the records stored at UNC Asheville. It also answers pertinent questions. Names can be verified and more information found using the interactive map under the data tab at urbanrenewalimpact.org. Documents mentioned can be used to assist in recommendations. A digital copy will be submitted to a designated individual for attachment to today's minutes. I pray that your recommendations will include compensations for property owners' family. I pray Asheville City, Buncombe County will right the wrong and not ignore the audits, documentation, community comments, and all that you present, referencing education, criminal justice, economics, and housing.
Thank
Urban
you.
renewal is as a spider web.
Thank you
We
so
are
much.
all entwined. Any way you touch it, it trembles. And anyone who wants to look, I have the documentation.
Thank you so much.
Thank you.
Can you read it?
Christy Kaiser Liontree? Christopher? Okay. Jonathan Wainscott.
My name is Jonathan Wainscott, and I appreciate you asking about representation earlier, Mr. Ayuda, because I've been just driving on this point for a few years now about how our electoral system had disenfranchised the Black community historically. I see Mayor Bellamy over there. When she was finished with her term, when Mayor Bellamy was finished with her term, she represented 1/3 of all of the Black representation on the Asheville City Council since it was established in 1931. If you want to talk about data, whether or not you can make recommendations on that, the accounting of our governance in this at-large election system is very easy to break down. Another thing when it comes to representation that has decimated the Black community is the Buncombe County Tourism Development Authority. I know that we all talk about tourism having always been here in Asheville, but the Tourism Development Authority was established in 1983. The Black community was holding at about 20% in the year 2000. It's down 10% now. In 2013, we raised our occupancy tax from 4% to 6%. All that money is going in there. How many Black people have worked at the Buncombe County Tourism Development Authority? 5 years ago, I asked that question to the CEO. The answer, which I already knew, was none. At the same time, the Asheville Chamber of Commerce had one Black person working there. It was the janitor. And I wondered why our press didn't cover this. And I went and I looked at the staffing at the Asheville Citizen Times, no Black people. The Mountain Express, no Black people. WCQS, our national public radio station, no Black people. Knowledge, opportunity, access, and resources, the Okra thing, man. Representation, where the Black community is today is a function of having no representation. That was structurally designed. And we don't have to go all the way back to slavery ending in 1865. We can go back to 2019 when the Asheville City Council changed its election charter with no public engagement. How many people know this? We changed our election system from a district election system, which had been given to us by the North Carolina legislature in 2018. And what did the city council do here in Asheville? We changed our charter and we reinstated a Jim Crow policy In 2019, 5 years ago we did this. Asheville has on the books right now an original Jim Crow policy when it comes to electing our municipal government.
Thank you.
Thank you so much.
Tracy Barlow.
Hello, thank you. Tracy Barlow. I wasn't planning on speaking, and then the gentleman who prompted me to think about saying something has left. But you guys are doing great work. There's a lot of work that needs to be done. But sitting back there, I'm a little confused sometimes. We've heard African American. I heard BIPOC, which I think stands for Black, Indigenous, people of color, minority, racial. We talked about multiple languages. But I think if we're trying to address our first, couple's community speakers, I think we're talking about descendants of slavery here. And so, is that a term? Black, African American incorporates at this point in our census statistics more than American descendants of slavery. And I just wonder if it's an opportunity to begin to disaggregate the data and look at specifically identifying people as American descendants of slavery so that we can make sure that we are addressing, stopping the harm. I guess you guys are using that terminology. Stopping the harm is different than reparations. Reparations comes from the word repair. And so going back to that idea of what about the damage that's been done for the last 400 years? It is way more than slavery, I agree. It's redlining, it's eminent domain. It's being excluded from every social service that there was in the beginning until, people fought to be able to be included. Farmers and shoe polish, so there's so much harm. One of the people, he was asking about an estimate. Dr. Darity, William Darity, he's an American economist, has written a book, Here to Return Equality, and he has done a pretty good job trying to estimate that damage and those reparations. And I do believe that reparations needs to come from the federal level. I think some good work is happening at a local level, but if you look at the reparations groups that have been happening around in cities and states, even California, as far as true reparations for the damage that's been done economically to American descendants of slavery, they're not addressing it. And so I think it's good work that needs to happen locally at Asheville, but there is an advocacy foundation that's developed specifically for American descendants of slavery. It's ADOS, advocacyfoundation.org, and it is looking at this from a federal perspective. There is a North Carolina chapter, so there's an ADOS North Carolina chapter that's available, that's looking at state opportunities, but the main focus is around federal reparations.
Thank you. Thank you. So, that is our last public comment. And so with that being said,
One last thing, Madam Chair, Vice Chair. W-9s, I need you all's W-9s.
Oh, yes, they're on here. Can y'all please fill them out on your way out and hand them to Salah, please, please, please. Everyone needs to do it. Thank you. Our next meeting, that is not the additional meeting, our next in-person meeting here is April 15th.
Tax day.
Huh?
Tax.
Yeah.
That's what it's saying.
It's okay, we in there. It's on the 15th. So let me see, meeting objectives. Our meeting objectives was the CRC final report writing team. We got that. Community engagement update, we did that. The report out from health and wellness, which was great. We did that. And Cease the Harm. It's the same thing. Cease the Harm final report presentation, which was great. We want to thank the Carter Group again for what y'all have done for us. Thank you so much. We definitely appreciate it. And so with that being said, Motion to adjourn?
So moved. Second.
Joyce, moved, Bobette seconded. We're out of here. Listen, you showing up is.
Next speaker.
Good morning. My name is Yasmin Abdusami Oakley, and I am a reparationist. And what we do is we teach our community and the surrounding communities about state atonement and the initiatives for reparations here in California. We teach our community the difference between lineage and race. Reparations is not DEI. Reparations is not race-based initiatives. And I suggest that this board learn the difference so that you can advocate properly for the descendants of enslaved and then emancipated Americans here in San Francisco. The San Francisco African American Reparations Advisory Board, while I tremendously respect their work, they did not do a good job in distinguishing between lineage and race. We advocate for the descendants of enslaved and then emancipated Americans to receive reparations in the form of direct cash payments. An apology is very low on our list. And our top priority is compensation, restitution, rehabilitation, and the guarantee of non-repetition. Getting cash repairs directly to descendants of emancipated Americans who are literally lining the streets of San Francisco. They are Americans. So I don't see reparations as a Black issue. It is an American issue. If you want to give an apology, you want to do it in the most expensive city in the world, these people can't eat an apology. Our youth are forced to break into cars because their wealth was stolen by this city and this state and this country. You need to designate land and housing specifically for descendants and housing specifically for descendants who have roots in San Francisco. And you need to give cash payments to those people as well. And you need to give some of those contracts that don't have any oversight, you need to give them to descendant American companies. And I bet we'll start having oversight then. Thank you.
Thank you for your comments.